Hi, my name's Bruno Silva. Today I'm talking to you about what is a wax tryin. A wax tryin is a specific stage of the treatment whereby we can test, we can check before anything is finalized, before the bridge is finalized, to make sure that both the patient and the dentist are happy with how the final bridge is going to look. So there's going to be no embarrassing surprises at the end if the teeth are not going to be exactly how the dentist and the patient wants them to look. With an all-on-4 dental implant treatment, you're looking at 4 implants used to basically support a whole upper or lower arch of missing teeth, and you then make a bridge that is supported on these 4 implants at the top or at the bottom. So usually the treatment's broken into like a first stage when you have surgery, and then once the surgery is being carried out and it's successful, then you'll be looking to kind of finalize the treatment by making the final teeth. And those two different parts of treatment are really very different. In the first phase, you're trying to make sure that the implants are correctly placed, that surgery is going to be carried out safely, and that scenario is dealt with. Once the implants are in place and they're working well, then the second stage, which is sometimes a more challenging stage, which is when patients start to want to actually make some changes to their smile, incorporate some differences to how the teeth looked before. And this treatment, strangely enough, can sometimes be more difficult than the surgery and the implant placement. So usually after surgery, you'll be having you'll have a temporary bridge. That temporary bridge may look really good. It may satisfy your expectations really well. But many times patients will come back and they will tell me that their temporary bridge, either the teeth are too long, they're too short, or the color needs to be adapted. Quite often someone passes a comment or says something that like, your teeth have changed. So we incorporate into our treatment plan workflow that these small changes can be incorporated. Sometimes even some small irregularities on the teeth that can be introduced to make the teeth look more realistic, so that someone else wouldn't assume that your teeth are too perfect and could be even artificial. What would normally happen is about 4 months after the implants are placed, your dentist will take some new impressions to make sure that he or she can take all the changes that have taken place in the bone and the gum tissues, and they will send a list of bullet points of changes to be made that are different from the temporary bridge. In some cases, if the temporary bridge looks really good and the patient's really happy, then the instructions might be to actually keep things exactly the same and not make any alterations. But quite often some changes are requested, and what the laboratory will then make is something called a wax tryin. You can see over here we've got like a full arch at the top and a full arch at the bottom, and this is actually made in wax. Quite incredibly, some very talented technicians who are working on this, and what will happen is this bridge, this is what a all-on-4 bridge would look like, okay? This bridge is then tested in the mouth. So we check, the patient will have an opportunity with the mirror to have a look, we'll take some photographs, some side profiles, just to check that all these little small differences or requests for changes have been made. Once we have those changes incorporated, sometimes we need to redo the wax tryin until we're satisfied that all the expectations are met. We will then ask the laboratory to finalize the definitive bridge. Now, the definitive bridge, it's not something that we tell patients that will last forever. There are different materials, and I will make a different video about that. If you look on our video stream, you'll see that there will be a video about the difference between a provisional bridge and a definitive bridge. But the definitive bridge will be made following the acceptance of the wax tryin. Alright, that's all for today. I hope you enjoyed this helpful tip on dental implants. If you have any questions, post a comment below, and I look forward to seeing you soon again. Thanks. Cheers. Bye-bye.